full, approximate, and partial. Client doesn't know, data not collected. Gender, and we haven't had really any data quality issues with all this so far. That's all coming in pretty easy as far as the demographics and the names. So this contact information, this is information that FEMA wants to see that we're gathering for these clients. It's important to note, and these boxes are missing at first, if they don't have a phone number, we want to say the client doesn't know a phone number. If they won't give it, they've refused it, or if it wasn't collected, we want to say the data is not collected. What FEMA doesn't want to see is just a bunch of blanks. We've been getting a lot of blank email addresses, and it's really common for someone who's experiencing street-level homeless. They maybe don't have an email address or access to it or remember it, and it's really easy just to mark, a client doesn't know it or client refused to answer. We're hoping to go back and get as rid of as many of these blank boxes as possible so the FEMA reimbursement reporting looks better. For their street address, if they don't really have an address, they can say they're homeless. You can even get the city and state that they've been homeless in. That counts as a partial street address. It's okay to say, well, they've been homeless in Ukiah for the last 5 years. You can even get where they've been staying. So if they've been staying at, let's say, the campground, the camp spot on the south end of town, you can record that location as their current residence, or if they know their last permanent address. FEMA just wants to see that we're getting some information, and we've been doing pretty well on that, and that's a lot of it the client doesn't know. Like, I couldn't even tell you where the last place I lived. As long as we're checking some box in there, it's good for the FEMA data quality to let them know we're asking the questions and the client can't answer them. Relationship to head of household, pretty basic, no issues with that. Self, we've been doing almost all single person entries.
Brian, can I interrupt for a second?
100% you can.
As you know, sometimes we have more than one person staying in a hotel room, and sometimes both of them qualify, and sometimes only one of them qualify. In what scenario do you want two people? Who should we be gathering data on?
From an HMIS data standpoint, it should be everyone that we're housing. As far as what we're reporting to FEMA, as long as one person in that room is reimbursable, if we've gathered data on them, that's the person who's answering all those FEMA questions. But as far as if we've got two people in a hotel room, if I'm putting my HMIS administrator hat on, we should be getting data on everyone that we're housing, which is also reflected in our CAPER reports that California Department of Social Services requests. That wasn't really our operational model going into this, because we started doing this very proactively, very early, before Project Roomkey existed, before we knew this was even going to be tracked in HMIS. So we're going to have to kind of look at how that's going to look on the back end. But moving forward, if we get information on everyone, the more information, the better, and not all of it gets reported to FEMA or California Department of Social Services. At first, there was a lot of confusion and unclear language on if people could even be housed through Project Roomkey unless they were one person, because it was supposed to be, a quarantine, isolation, you're self-secluding. And their language on that has gotten a lot softer. So over time, over the last few months, it seems pretty common that they understand there's going to be sometimes more than one person in a hotel room as it makes sense. Even today in Governor Newsom's press conference, he was talking about the number of rooms, and he said specifically, and that's just the number of rooms, sometimes there was more than one person in a room. So early on, I know it was really unclear guidance from the state on what should be acceptable, but they've really backed off on kind of pushing for single rooms in the language I've been getting from Project Roomkey and leads, so I don't consider that an issue anymore, as long as the one person in the room meets the requirements.
Okay, thank you.
So, homeless history, these are all the HUD-defined answers, really important. And I mean, this is HUD HMIS data, but FEMA also wants to see, so the FEMA outlined all the HUD HMIS data they want to see on their reporting. So there's some things you normally see, like cash income, non-cash income, they're not on this intake because the state and FEMA said, we don't need that data. This project isn't funded by HUD, so we don't need to gather it if the community we didn't decide it was necessary. So we tried to make these as streamlined as possible. So the HMIS data that's left is very specific that FEMA California Department of Social Services says FEMA's going to want this information when you go to get reimbursed and start doing reports. And this, if you've never worked with HMIS before, you'll want to take a look through those and make sure you understand each one. If any of those fields kind of don't make sense, feel free to reach out to your HMIS administrators or someone in your agency that uses HMIS frequently if you're not quite sure how to categorize someone. For most people we're dealing with, they're coming from a place not meant for habitation, which qualifies as literally homeless, or an emergency shelter if they're staying at one of our bigger shelters and need to get out to be safer. All these count as coming from a literally homeless situation. Does anyone have questions on anything I've talked about so far? And if you need to be unmuted, I can't see everyone's video if anyone's talking.
Brian?
But you should. Yes.
Brian, this is Judy. So,
Hi, Judy.
you know, hi. So when you opened it up to domestic violence, okay, and so I've never actually seen these HMIS forms before.
Yep.
So some of them, you know, were, you know, a lot of these categories won't necessarily fit because they were like living in a situation that became dangerous, and that was the reason why they left.
So that's going to be under transitional and permanent housing, staying or living with family permanently and they had to leave, staying and living with friends permanently, staying or living with friends or family on a temporary basis.
Okay, so overall, it's all right if some of these categories are left blank and you're just hitting one or two in one of these categories, right?
Every part that has a box that needs to be checked, one of these needs to be checked in it. So when someone's history just means where was the client living immediately before coming to this project? So you only choose one of these boxes. So you're not getting like a whole homeless history of everywhere they've ever stayed. In this case, if someone needs non-congregate shelter, where were you staying yesterday? Were you on the streets? Were you staying with family? Did you rent or own your own house? Does that make more sense?
Yeah, but so like each one of these little boxes, one thing has to be checked or not?
Yes.
So in other words, oh, they do. Okay, so something has to be checked there in each one of the headings.
Yeah, that's both HUD expected as well as Project Roomkey FEMA expected. There's not a whole lot of data on these forms that's optional. One thing we completely removed was domestic violence history. Because these are emergency shelters, these aren't homeless shelters, there's a lot of questions. Let's say we open up a fire shelter. We're not asking people registering for the fire shelter if they're escaping domestic violence. It's part of, you know, the social work that's being done to get people into this, but we're not collecting it from a data standpoint, because when someone needs an emergency evacuation shelter such as this, you're not asking income, you're not asking insurance, you're not asking non-cash income, you're not asking domestic violence status. And that was set up by the state and FEMA as these questions don't really pertain to a sort of, it's not a homeless shelter specifically, it's targeted to homeless, but this is an evacuation shelter for people who have a need during a crisis, an epidemic, a pandemic. Does that make sense?
Yeah. Okay. So, and then one other thing, where do I get these forms? And then we do have a client that is supposedly getting on a bus on Monday. And I know we haven't filled out any of this paperwork for her. Hopefully they don't need to sign anything or.
There is a spot for signature. The forms you can get from Heather and Megan and Veronica in the Home and Act teams.
Okay.
You can also post them on our website if there becomes a strong need, but I think most of our forms have already went out. This training, it's a little retroactively, but if we're going to be operating for another month, which we'll know in the next few days, it's still going to be proactive on top of retroactive.
Can you hear me?
Yeah.
Yes.
Okay. Judy, because your clients are in under a different funding, they don't have to qualify on the medical side because there's a different funding for that. So they don't have anything that they need to sign. So you could do that form over the phone.
Oh, good. Thank you.
Although I would say that we have clients that overlap programs, so they may be CalWORKs eligible or eligible in some other way, and it turns out they do have a qualifying condition. And if they do, it'd be really good to know. So Judy, if some of your clients actually possibly are over 65 or have an underlying health condition, we would rather fund them through the FEMA program because it reimburses 5%.
Sure, absolutely.
So what could be best practice for that is to go over, and you'll see this medical cert form a little later in this training, is to run over that with your clients, and if they answer no to everything, you know, you've got a different way to take it. Then if they do end up answering yes to something, we can work on moving that forward too.
Okay.
All right. But, you know, so type of prior living situation, like I said, this is directly what they were doing before they got to you and where they were staying. The length of stay in their prior living situation, you know, if they were staying with friends or family, how long were they living there? Pretty easy to fill in. No data issues on this too far. The approximate date homelessness started this time. So if they're still staying with someone and they need to get out that day, then you would use that day. This date does have to be filled in, and it could, sometimes we're dealing with clients who are like, I don't know, I've been homeless since 2004. If you even put a year, because it's approximate, we can work with a year, we can work with a month. They don't have to know the exact date. It is approximate date, but there needs to be something in there. You can't put something like, oh, client's been homeless their whole life. So maybe that requires a few more questions like, well, does that mean, you know, when you were 18, when you first got out of your parents' house, or since you were 12? If you can get it down to a year, that's good enough for HUD data quality. The way I do it, if someone puts a year, I go from January 1 of that year. If someone puts a month, I go from the first day of that month. But we need something there. It can't be a narrative saying, you know, it's been homeless forever. So regardless of where they stayed last night, the number of times they've been on the streets in an emergency shelter or safe haven. Safe haven is a specific kind of shelter that we don't have in this county. In 1, 2, 3, 4 more times. Just to give a little bit of chronic homeless training, if someone's been homeless 4 or more times in the last 3 years, they qualify as chronically homeless. And this next question is the other chronically homeless qualifier. If they've been homeless more than 12 months consecutively, they qualify as chronically homeless. So if you click this box or this box, for anyone that's working on coordinated entry, which requires them to be chronically homeless, that means it's yes. We've been getting some minor data quality issues with the total number of months. If you select 1 or less months, you select the box. If you select between 2 and 12 months, you still have to write in the number of months, whether it's 8, 9, 10. So if you click this box right here, you've got to go over here next to these red letters in bold and tell us how many months the client's been homeless, that number between 2 and 12. And this is all in the last 3 years, so it's not this time. Like I said, if they answer 4 or more times or more than 12 months in the last 3 years, they are chronically homeless. Disability status has to be answered. Anyone going into these projects mostly should be answering yes to this question. We do have some exceptions for families and DV. If they're answering no to that, you're going to want to double back with the advocacy and collaboration team and make sure we're on the same page, just because it's very much an exception, not the standard for this non-congregate shelter project, which is geared towards high-risk health conditions. This area under disabilities, and I'll stop. Does anyone have any questions at all about homeless history so far? Once again, if it's got a spot on the form, there should be an answer. Even if the answer is client doesn't know, client refused, we need to be asking the questions and documenting what the answer is for the FEMA data quality for reimbursement. And we'll move into disabilities.
Hey,
yeah.
Brian. Just to do a little logistics for the meeting, we've had a few people join us since we started. One person is calling in on a phone that ends in 541, and I was hoping to find out who that person is for our attendance sheet. They are muted, so I may need to unmute them if we don't hear from them. Okay. I unmuted you 541. Who are you? You may be muted on your phone.
I'm Shay. I work at Hillside Health Center. I'm a nurse case manager.
Hi, Shay. Welcome.
Hi.
Thanks. Okay, Brian, go ahead.
All right. So we're looking at disability status, and as I was saying, if head in a spot on this form, it pretty much needs to be filled in. If you answer yes to disability status, one of these boxes under disability types needs to be yes. If you answer yes to any of these disability types, then the disability status needs to be yes. Sometimes clients, you'll ask them, do you have a disability? And they think, I don't have a physical disability. They answer no, and then someone comes down here and says, well, I have an alcohol abuse issue. That is a disability. So if any disability type is yes, then the disability status is yes.
So Brian, can I ask a question? Brian?
Sure.
So I wasn't thinking of disability in that way. So it's not like they're on Social Security disability that they've been approved for disability. It's their own personal view. Do you have a disability?
So yeah, all the HMIS data is client disclosed. So it's these barriers that HUD has defined as these are the barriers that prevent people from being homeless and being successful that need to be evaluated, looked at, managed. These are the barriers we need to gather data on. So alcohol abuse.
So the
chronic
disability status is a self-assessment, not the official Social Security disability.
100%. It's client
Okay,
disclosed, and this doesn't tie back to Social Security or benefits or anything. This is if the client has one of these disabilities. So it's a self-assessment in the event you're asking them all these specific disabilities that HUD wants HMIS data on. So there might be something they consider a disability that's not on this list. If they answer no to every one of these, the answer to disability status should be no. If they answer yes to any of these, the answer should be yes. So for people who are not looking at the sheet, alcohol abuse, chronic health condition, a developmental disability, drug abuse, HIV/AIDS status, a mental health problem, or a physical disability, those are the HUD HMIS disabilities. And if they answer yes to both alcohol and drug, there's an extra box to check just to show they have both. That's not an HMIS data point. It's specific to our vendor, but it's there. And one area we're doing really poorly on, if anyone answers yes to any disability, you have to ask them, is that disability expected to be a long, continuous duration that it substantially impairs your ability to live independently? So if the client comes in and they have crutches, they have a physical disability, but the crutches are coming, their cast coming off next week, and there's no other issues, that wouldn't be a long, continued, and indefinite duration that substantially impairs your ability to live independently. So anytime you say yes to any disability question, you need to ask if it's going to be an unknown duration or a long duration and impairs their ability to live independently, and that's still client disclosed. So we're not getting down to, well, if it's 12 to 24 months, it's kind of up to them, with being reasonable, if their disability is long-term. If they say they have an alcohol abuse issue, but they've been clean and sober for 2 months and they think they're good moving forward, it's a lot of client self-disclosed information for disabilities. But we have to get a lot better at asking that question if it's going to be a long duration and affect their ability to live. The exceptions to that are developmental disability and HIV/AIDS. HUD defines those disabilities' existence as being a long duration and impacting their lives just by their existence. So those we just click yes on. And that was an update to the form. I think the original one has more check boxes, but you just still click yes on them. But we don't have to ask someone with HIV/AIDS if their condition is long-term. That condition is long-term. We don't have to ask someone with developmental disability if their condition is long-term. It's going to be long-term.
Brian?
Yes.
This is Grace. So this is similar to when we do a VI stat, but like for clients that we know very well that have mental health problems or substance abuse issues, if they aren't willing to self-disclose, but you have the knowledge as a case manager that they suffer from that, are we allowed?
Yeah, and that's where having our local partners managing these cases is super important. A lot of people we know with these want to answer to look the best, but
yeah,
if you have a case manager that knows certainly that data is not accurate, yeah, HUD HMS, it allows you to make those kind of revisions because the
use our
client
judgment. Okay,
accurately.
thank you.
And everything past this is data that FEMA is going to need. So this stuff isn't what you normally see in HMIS. So their COVID-19 screening results are going to come from the screening tool we're going to look at next, and you have to choose one of these. Every person that you're housing part of non-congregate shelter should be asymptomatic high risk. You might have a few people who are asymptomatic low risk who meet that family or DV criteria where they're getting in even though they're not high risk. So you should be checking one of these two boxes, almost always high risk. If they report COVID-19, like that just needs to come over to public health and that ends up going through my unit in the operations center. But we need to have these on there because it's the HUD FEMA standards for reimbursement. Because I'm also using these same forms to track clients who are put into isolation quarantine shelter, but it's so minimal, it's not something we need community partners to do. I've just taken care of it. And their screening results documented or verified. If they sign off on the medical form, we're going to look at it a bit. That counts as verified for right now. That they've self-certified, I do have one of these conditions, and we'll look at that form really in depth in a few minutes. This question was a little misleading. The next one, do you have the ability to isolate or quarantine without assistance? Was the phrasing that CDSS gave us, and some people were taking that to mean, can you stay in isolation without having someone to come in and help you take care of yourself? What that question is asking the client is if they can isolate, if they have somewhere to safely be and don't need assistance with housing. So I updated it in the most recent thing to say housing assistance. What that question is making sure we're not putting people in the non-congregate shelter who have means to take care of this themselves. I don't suspect we've done that at all, but some of the forms we're getting do say yes. So we're just going to go back and partner with the case managers on those to make sure that they were misunderstanding the question, because we don't want to be reporting to FEMA that we're housing people who don't need the help to do so. And I don't think that's the case at all. We're just going to have to clean up some of the data points, and I made the question a little more definitive. Does anyone have questions on disability types before I get too far away from it?
Brian, I don't understand the acronyms of the DNC or.
Sorry, and those all come from HUD HMIS data, and you can find them up top. Client doesn't know, client refused, data not collected.
Oh, okay. Gotcha. Okay.
In order to keep this form not being 5 pages long, we use some acronyms and abbreviations. But
that's
you
good.
don't remember, you can refer to the top of the form. And for anyone who's working in the HUD HMIS world, like you've been looking at those answers for a long time. So I know it is new for you, Judy.
Okay, thank you.
Yeah, and if anyone has any questions on this form, you can email someone from the Home or ACT team with questions if something doesn't make sense. Moving forward, like we want to make sure everything's kind of done consistently and accurately. We've been having the most trouble with the disabilities because a lot of people will just say, yes, there's a disability and not ask the status of the disability.
And when you send in emails, if you could include all 3 of the members of the home team, myself, Brian, and Gary Colson, that way one of us can get back to you quickly. If you send it to just one of us and we're out of the office, it might take a little longer.
So the last part of this form is the household composition. Once again, this isn't standard HUD data. This is all what social services for California say FEMA is going to want to see. So they want to know the number of the adults in the household that's staying in the room, the number of children in the household staying in the room. everyone should have at least one adult. If there's no children, it's a lot better if you put a 0 instead of leave it blank. We do have some records through ACT, Heather, Chris, and Megan that we can refer back to, but for data standards, it's always good not to leave any blanks. If something is 0, write in a 0. And all three of these questions on the right need to be answered. Does the client have pets with them? No. Some people, I think, are assuming if they answer no to pets, they'll say no to service animal. For FEMA standards, a pet and a service animal are two completely different things. So we just need to be saying yes or no to pets, to service animals. And if there's an access or functional need, and that very much is coming out of the FEMA world, and it's referring to people who are most at risk during a disaster. And almost everyone we're housing, if they have those high health risks, they should have an access and functional need, but that also refers to any seniors, children in general, anyone who's non-English speaking, if you're pregnant, or if you're transportation disadvantaged and can't advocate or get yourself out of a disaster. AFN's kind of a global, it covers all those categories. So we should be seeing yes to that access and functional need on all these intakes, except for those rare instances where we're working with families or DV status who maybe there's not that health high risk need in there and they don't have any of the other access or functional needs like language issues, transportation issues, pregnancy. We'll quickly look at the exit, which is going to be coming up pretty quickly if the program's not continued for a month. The exit form is really basic, really simple.
So Ryan, just to confirm, none of the people on this call have seen these yet because we've not done them.
Okay. It's a one-pager. It's pretty much, it's all HUD data, so anyone who's worked in HUD has seen it. And we'll just look, I figured it was a good time to look at it because people might be exiting next week. So the date they left the program, the reason, so if the non-congregate shelter closes because there's no more funding, they completed the program, they didn't do anything wrong. Some people have left because they had a disagreement with the rules or they just disappeared. So there's all these normal answers. The bulk of everyone who leaves at the end, those should all be completed programs. And the rest of these reasons are pretty standard. More importantly, by far than the exit reasons, is HUD wants to know their exit destination and FEMA wants it too. And destination doesn't mean they went to Florida. It wants to know the housing situation we're sending them back to. Are they back out on the streets? Did we find permanent supportive housing for them? Were they able to get housing on their own? Are they staying with a friend? So you can see all these different answers. And this exit destination is extremely important to be getting at the exit. It's really important for the FEMA reporting and really important for HUD reporting and for our COC that we're collecting what the housing situation that they're exiting into is.
Brian, well, I mean, we haven't really, because we're doing all this in real time, we hadn't really talked about who was going to be gathering this data. Is it possible, or would it make sense for the ACT team or home team or whoever, HHSA staff, just to fill this out based on phone conversations with either the client or the service provider?
Yeah, I'm not trying to direct that part of it, so that seems appropriate to me. As long as someone can be getting the information, I suspect you'll probably need to use a combination of phone calls, or maybe they've exited and you need to find the case manager who's worked with them and can find them later. But if the bulk of it is done through, if the ACT team can do phone calls, that's completely appropriate.
Okay. We're keeping track of this with sort of minimal notes on our master spreadsheet. So I think just as a message to all of you that are participating, it'll be likely that we will take care of this exit paperwork here with your assistance if you know what happened to your client. But I think it's also really important to ask all of you, I think you're doing this already, but if you have a client that's leaving and you know where and when, definitely make sure you let Heather or Veronica, really any of us know, but for right now, please let Heather know because we think we know when people leave or where they're going, but we don't always. So don't assume we know.
And this exit destination region, this is standard for any HMIS project. The other part of it is we're supposed to be asking clients if their disability status has changed. Because this duration is so short term, I'm not expecting any significant changes or almost any changes in this. It has to be included because it's part of HUD data but I'd be really surprised if someone's disability status changed over a month or two. It's a data possibility, but I'm not expecting to see this too often. So the real important part is that we're getting when they exited and the housing situation they exited to. So even if you're not doing the paperwork, for all the clients that you're working with, if you're able to have enough of a relationship with them to know where they're going to be exiting to, that's real important. So that is the entire intake and exit. Does anyone have any questions about those so far?
Where do we get the copy of them?
They'll be emailed to you sometime today.
Okay.
Judy,
The other thing,
Judy, thank you for participating in this. We really were kind of prioritizing information, and because of the DV clients were a little bit separate, we probably weren't including you as quickly as we should have. So we'll make sure we get that information into you.
okay. So the other question is, I understand from Heather today that it's being extended till next Friday for some people who are in the hotels. Is that correct?
Yeah, maybe I'll make that announcement now. I did send out an email to a lot of people this morning, but not everybody. We have plan A, B, and C. Plan A is that FEMA does the extension for another 30 days, and we would include the DV clients in those as well. We're still hoping for that favorable outcome, but FEMA is taking a really long time and it's stressing everybody out. Plan B, I have requested funding from the California Department of Services in this sort of nebulous funding source for a transition once the subsidy of FEMA ends, to plan an orderly transition. I still haven't heard back from that, but that could possibly be an option. And then plan C is we would do an emergency request to the COC to use the HEAP interest funds in order to have an orderly transition again. Those last, it would enable us to have people housed through June 5th, just so we can have some organization to how this works. So the short news is people do not need to leave their motels on Monday. Worst case scenario, it would be Friday, but best case scenario, we have another month.
Okay. So if are we the ones, whoever is sponsoring a client should notify that client that they don't need to leave on Monday, but they can stay till June 5th?
Yes, we have noticed that the motel owners have all been notified, and they're pretty pretty good at communicating with their clients. But definitely, if you have clients you're worried about and want to call directly, you can. We've been letting the communication system somewhat happen organically, which is not a great way to do it, but it seems to be working because the guests tend to talk amongst themselves as well. But Heather did notify the motel owners this morning.
Okay, thank you.
Excuse me, Brian.
Yes.
Teresa Bloyd, APS. I just have the one question, and thank you, Megan, for that information. I will call my client. I have one question, Brian. As I go over this paperwork when I get back in the office, the copy I have, if I notice that I left anything missing or not completed, how do I correct that?
You can make a correction on the form and drop it off with Gary Colson down the hallway.
Okay, so
you can send out an email. So what Gary and I have been doing is making a list of all the corrections that need to be done, and we're going to be, as soon as possible, contacting people that didn't attend or weren't aware there were corrections that need to be done. So we'll be reaching out on that too. But if you're proactively on top of it, you can email it back to Gary. You can drop it off with anyone on the home team, Veronica, and we'll make sure it gets updated.
Perfect, because it's very minimal. I believe it probably is length of disability as we're going over it. I don't think that was done, but I'll get a hold of Gary and we'll get that corrected on Monday.
So before I move on to the medical form, which will be pretty quick, I'm going to quickly just go over and highlight the real most common areas we've been having data issues with. So we looked at the whole form, and now I'm just going to spotlight the ones that keep tripping up our data process. So that's going to be the contact information. FEMA wants something there. Once again, if they don't have it, just say the client doesn't know. They don't know a phone number, they don't have one. If they don't have an email address, if you even write in none or non-applicable, whatever you can do so we can let FEMA know we asked the question and they don't have it, that's completely acceptable. For last permanent address, as long as we're putting something there, if they put the last city they're staying in, there just needs to be something in this field that they know their old last permanent address. That's great data to collect. We want to make sure we're getting an approximate date. Homeless started with an actual at least year. And once again, to summarize just for everyone, 4 or more times means chronically homeless. More than 12 months in the last 3 years means chronically homeless. Disability status needs a duration if you say yes to anything. If you say yes to anything, then disability status is going to be yes. You can't answer yes to disability status and then answer no to every disability type as well. Your COVID screening results are going to come from the medical form we're going to look at. One of these boxes needs to be checked. Whether it's documented and verified means the client signed the paper on the medical form. So those should all say yes, unless we have a rare case where they don't need to because they don't meet that condition. The ability to isolate or quarantine without assistance means without housing assistance. It means they have their own housing if they wanted to use it. The answer to that should be no for everybody. In everything under household composition, there should be something there, whether it's a 1, a 0 in adults and children, and it should be a yes or no to pets, a yes or no to service animal, and a yes or no to access and functional needs, most commonly going to be yes. And those were kind of the areas we were getting the most data issues, and I'm going to look at the medical form, which is pretty simple. Not having a lot of data issues with the medical form so far. It's 2 parts. One is the client kind of self-certifying that they have a high-risk condition, but we're also...
Hey, Brian, sorry to interrupt. Can you zoom in a little bit more? It's hard to see.
Oh, yeah, it's really big.
Thank you.
All right.
Yeah.
Look at the 2 parts of the form. We're gathering their name and date of birth, motel name and location. It's really important to get the motel room number. That's also a data point that FEMA wants to see on the reports. They want to see down to the room where people are housed. A motel name and location, and we can look up room numbers retroactively and figure it all out, but if it's on the form, it's a lot easier. County of residence, their primary care provider, the address of that provider if they know it, the phone number of that provider if they know it. Not everyone's going to, some people might just tell you Hillside Health Clinic, and we can fill in the address and phone number from there if you don't know it or they don't know it. I find a lot of our partners actually know the addresses off the top of their head. But if those 2 are missing and we know where it is, the clinic or hospital, that's okay. So this is the part where you're printing their name or they're printing their name. We want to get a signature for them where they're stating one of the things that follows, and then you're signing it as a witness as the person doing the paperwork with them and dating it. And they're stating, I'm at high risk of complications because of one of the following conditions: 65 years of age or older, chronic lung disease or moderate to severe asthma, a serious heart condition, immune system is compromised due to cancer treatment, HIV or Hep C status, prolonged use of corticosteroids or another reason. They have diabetes, liver disease, severe obesity, which CDC defined as a BMI of 40 plus, or chronic kidney disease. Everyone that we're housing should be clicking this box and saying they have a high risk in at least one of these health conditions. If they're selecting their COVID-19 exposed or diagnosed, that's going to be someone that I'll be dealing with. You shouldn't be having people select that option. If they are saying they're COVID positive, we need to be making sure that that isn't the case because they should be somewhere else. And this is as long as the client signs this and selects one of these conditions. What you don't want to do is they put an X in this box and then you don't collect what condition they actually meet. That's not good enough for the FEMA reporting. They just want to see we're collecting what condition or conditions they do meet. And this is, once again, this is client disclosed. We hopefully are not going to have to ever go to a place where we got to get medical backup. The current thinking is FEMA is not going to get that intense, but we've got a second part of this form to cover the cost and liability of these rooms in case we do need to get that medical backup documentation.
Hey, Brian, I have a question.
Sure.
On the signature portion, where it says witness, if the individual signs with an X, you had said that case managers could sign there. Is it necessary for them to sign if the client can sign on their own?
So this form is pulled from an IHSS form, I believe. I'm guessing that language probably comes from the IHSS form. Megan, can you speak to that at all?
Yeah, when I was just trying to pull a form out of nowhere, this was suggested by a really good idea to use the IHSS form, so there could be some things left over from that. FEMA and the state have not provided us a form for this, so we are not, actually, they have one that's much worse than this. So yeah, long way of answering. Yeah, I just pulled it from an old form.
So yeah, I mean, full disclosure to everyone, this isn't something FEMA gave us. Megan put it together. As long as the client signs it and there's a witness, I think we're super backed up. If we have both those signatures, the more documentation we have, the better. The real problem with FEMA is you start asking for money and they start saying, well, what's this? Do you have this information? So always err when it comes to these non-congregate shelter situations on the side of more information is good. But as far as that individual signing with an X, I have no idea what that means. I don't think it's not applying to our particular situation, so you could even ignore it. It's just sort of something that slipped into the form because we created it in like a day and a half, probably. But
Yes,
thanks for spotting that. I think I've done 3 proofreads of this form along the way and didn't take a look at that part.
I had one thing to add because one of the clients had signed this form and they altered it with an expiration date. And they should not be doing that. You should not be allowing that. If we're paying for the room, they need to sign this as it is without any other additional conditions. Because if we need to, for our FEMA funding, to go back and, verify their medical condition, we don't want any conditions that are gonna, on their release, that are gonna prohibit us from doing that.
And so to tie in this first page of the form back to that intake form, so if they sign here and they say they're at higher risk, then that's where you go back to the screening results. They said they're asymptomatic high risk, and we've got the documents verified, the form is signed. So that's exactly where these 2 data points come from, is using this screening tool. You don't have to really guess or think about what it is, you just can pull it straight from the form. The second half of the form kind of allows them to sign off, and we can get this part filled by, if we need to go back to the clinic, the hospital, a trained social worker, or someone to say, if FEMA comes back and says, well, we want more proof on these certain people, or we want more proof for everyone, this is giving us that retroactive authority to go back and verify their health condition with something with more authority than their self-certification. As of right now, we don't anticipate needing it, but trying to go back and get this permission retroactively from 200-something clients who are mostly coming from homelessness would be quite a task. So we're making sure we're covered, and we're going to use this if we need to make sure that we get reimbursed for FEMA for a very large bill. So that second part is filled out by health professionals.
Yeah, Brian, I will say some people that have filled out the forms are licensed in some way, and they've been signing them, which is great. So go ahead and sign. If you would do the back form, if you feel like you have, if you're a social services professional or a licensed social worker or something like that, if it turns out, worst case scenario, we have to go back and get further documentation, someone can just sign below you. So it doesn't hurt to sign it, if that makes sense.
Yeah, perfect sense. So as Megan said, if you are a trained public health, social services, or healthcare professional, if you can vouch for any of these and can sign off on them, that will save us time if we have to get that far. If you're maybe a frontline desk person helping out in an agency, you would just make sure they at least sign it so we can go back and have this done. But yeah, definitely, if you meet this criteria to verify the status of the client, please fill it out.
I would say specifically to McCavan, I mean, you have access to healthcare records around HIV status or Hep C status, so I would definitely feel comfortable with you signing on it if that's their qualifying condition.
Yeah, and once again, this form, it's not something that the government gave us, we made, so it's kind of, to some degree, up to our own community's interpretation. So it's not like you have to be a doctor to fill this out. Just something with, to me, authority that's provable and viable that it would obviously make sense this person can verify this status without getting too into definitions. Just use your best judgment.
So Brian, you know, we didn't necessarily do for our domestic violence clients like this kind of a level of medical screening, you know. So shall we, I mean, there might be one of them that might actually fit into this criteria. So should we attempt to do it with whoever was placed in the motels under domestic violence?
I mean, for me, being a data guy, if you call them up and just walk through these 7 conditions with them, it doesn't hurt to get this extra layer of documentation and have FEMA pay for the room instead of pulling from local funds or the COC. Let's go ahead and get those FEMA dollars. If you know they're already 65 or older, that's a real easy condition to verify you have their date of birth already.
Right.
So that's just going to be getting that signature from them on the top.
Yeah, and the obesity one, the 40 plus, does that mean 40 pounds overweight?
The body mass index.
Yeah, a lot of people probably wouldn't know that.
Gotcha.
Yeah, they might not. I found, yeah, but Judy, I have found this crossover when I've asked some of the families that are CalWorks families, does anyone in your household have asthma or and diabetes? And
right.
It's turned out to be true, yeah. So which is
okay.
just good to know. So we have multiple options in terms of figuring out how to fund them.
Okay.
And Judy, if your question about obesity is like kind of a make or break one, you can always Google what they mean. They usually have tools on there that it'll be easy for you to judge.
Okay.
And that is everything I have to say about these 2 forms and FEMA non-congregate shelter emergency motel housing. I will open it up for any questions.
I'll wait for a minute for questions, but go ahead and ask questions if you have any. I want to thank all of you for doing this training. As Brian said in the beginning, we're doing a lot of things backwards because we started this program so quickly. So this training is something that we can keep track of and verify that you were trained in completing this paperwork. I will also say that the third document that was in your packet was what we were calling a personal plan for the future. It was like a housing assessment. We don't need to do a training on that piece because it's not really a data quality. It's not a piece of information that we're using to enter into any systems, or we don't need it for reimbursement, but it has been very helpful in our ability to figure out the housability of each client. We've started a process here where we're taking all these packets and it sounds a little harsh, but what we're trying to do is figure out if this person has a clear path to housing that might be kind of easy, medium, or hard, and we're classifying them in that direction so we know how to work with those populations. And if we get an extension from FEMA for another month, we'll be able to do this kind of work much more intentionally in terms of a housing plan for each person. Honestly, if we have to have exit the motels on June 5th, it's going to be much more haphazard, much more kind of an intense triage kind of situation. So we'll be going through one or either one of those paths, and we'll know that on Monday.
Megan, I just wanted to add that, sorry, just real quick, there was one packet that didn't have any information on the personal plan. So if you know you weren't able to provide really important information, if you want to go back and revise that and send it in to one of us, that would be cool. Go ahead, Judy.
So are there attachments to the Zoom meeting for like these forums and everything, or?
I have no idea how to do that.
We don't know.
But I could send them out.
Yeah, I just know I need these. Okay.
Yeah, Veronica will send you the packet, Judy.
Okay, thank you.
It is 2:28 if there's no other questions.
Before we end, I want to make sure that I get a full list of all of the attendees. I'm pretty much able to see everybody who's at a computer because your names are listed, but I know that there's some people like Grace. Are you hosting it for all of your staff right now?
Yes, they're all here.
Okay. Okay, so I'm going to come back to you in just a second. Does anyone else on the call have multiple people attending? Besides Grace? Like maybe Julie? You know what, Julie? I think you're on the phone and I think you're muted.
Yeah.
Oh. I'm trying, Julie. It's not letting me though. Yeah. There we go. Julie, we can hear you now.
Okay, good. So no, it's just me attending right now.
Okay, perfect. Okay, so Grace, if you could just stay on so I can get all of your staff, everybody else, you're good to go. Unless you have other questions.
Okie dokie.
Okay, thank you.
Thanks, everybody.
Thanks.
Have a good weekend.
Goodbye.
Bye, Brian. Okay, Grace, who all do you have there? If you could just do like everybody go around and tell me your name, that would be cool.
Yeah,
Maybe
I've got
easier.
Keith Driver, Jake Petrikowski. They're around in the office right now. They just dispersed. Jake Petrikowski.
Oh, you know what? Hold on just a second. Let me stop.